This PowerPoint is discussing and understanding the differences between normal eating and eating disorders. What is normal eating? Normal eating includes the ingestion of healthy foods, the intake of a mixed and balanced diet that contains enough nutrients and calories to meet the body's needs, and a positive attitude about food. An eating disorder, it's defined as a psychiatric illness clearly defined in the Diagnostic and Statistical Manual of Mental Disorders. There are 8 specific categories of eating-feeding disorders, but we will focus on 3 main types: anorexia nervosa, bulimia nervosa, and binge eating disorder. Taking a closer look at who eating disorders affect. For many fitness enthusiasts and athletes, the symptoms can be gradual progression from athletic eating to unusual eating habits. For example, eliminating all carbs, no fats, and frequent cleanses. The statistics paint a picture of the diversity of people with eating disorders and disordered eating. 13.4% of girls and 7.1% of boys aged 9 through 14 exhibit disordered eating behaviors. In women over 65, strict dieting, fasting, and binge eating tripled from 1995 to 2005. 46.7% of athletes from leanness-focused sports report eating disorders. Among more than 800 Norwegian fitness instructors, 20% of males and 59% of females had eating disordered symptoms. 13% of young women meet the DSM's Edition 5 criteria for eating disorders. What causes an eating disorder? It can be caused by low self-esteem, an intense fear of being fat, perfectionism, difficulty with life transitions, rejection, whether it's real or perceived, depression and anxiety, family history of eating disorders, or media, sports, occupational pressures. Closer look at anorexia nervosa. To be diagnosed as having anorexia nervosa, according to the DSM Edition 5, an individual must meet the following criteria. 1. Persistent food restriction or refusal to eat, resulting in significantly low body weight. 2. Disturbance in how the person views his or her body shape. 3. Intense fear of gaining weight or becoming fat. Although excessive exercising is not a criterion for anorexia nervosa, early detection of a symptom can be life-saving because this disorder is not just the deadliest of eating disorders, it is the deadliest of all psychiatric disorders. Women are at a higher risk for developing anorexia nervosa than men are, and the risk of premature death from anorexia nervosa is 6 to 12 times higher in women than in men. Some physical signs of anorexia are low body weight, feeling weak or tired and faint, thinning hair, dry brittle nails, frequently feeling cold, and purplish skin on arms and legs. Long-term complications can lead to osteoporosis, bone fractures, anemia, amenorrhea, decreased kidney function, heart problems, and the fact is up to 15% will die if untreated. Bulimia nervosa is more common than anorexia, and according to the DSM-5, the minimum criteria for bulimia are binge eating occurs on average at least once a week over a 3-month period, followed by compensatory actions such as vomiting, use of laxatives or diuretics, and/or excessive exercise. Binge eating is defined as recurring episodes of eating significantly more food in shorter periods of time than most people would eat under similar circumstances. Body shape and weight influence self-evaluation. Although people with anorexia nervosa have higher mortality rates, the suicide rate for bulimia is greater, with suicides accounting for 23% of deaths among people with bulimia compared with 20% among those with anorexia. Some signs and symptoms: going to the bathroom after a meal, overeating without weight gain, secretive eating or hiding food, exercising excessively, and frequent discussion of body weight and image. Some consequences of purging: vomiting, stomachache, heartburn, worn enamel on the teeth, swelling of the neck glands. Use of diuretics can lead to dehydration, loss of nutrients, and heart problems. Laxatives can cause cramps, stomach pain, digestive upset, and dependence. Diet pills can increase heart rate, can be habit forming to control the appetite. Overexercising can lead to fatigue and injury. The third is binge eating disorder. It is the most prevalent eating disorder, with 2.8% of U.S. adults suffering from it. Women aged 45 to 84 are more likely to binge and feel guilty about food than younger women. Binge eating happens at least once a week for 3 months. Binge eating episodes are associated with at least 3 of the following: eating more rapidly than normal, eating alone because of embarrassment, feeling disgusted, depressed or very guilty after eating, eating without being hungry, and eating till uncomfortably full. Binge episodes are marked by feelings of lack of control. Binge eating is not followed by compensatory actions associated with bulimia nervosa. Some long-term health risks: diabetes, high blood pressure, high cholesterol, gallbladder disease, heart disease, shortness of breath, cancer, menstrual fertility problems, and sleep problems such as apnea. Body dissatisfaction happens when an individual's image of his or her body doesn't match the perceived ideal portrayed by the media. This problem is not limited to people who think they're overweight. It can also affect very muscular individuals who think they are not muscular enough. Research indicates that people with perceived rather than real excess weight who relentlessly pursue thinness may increase their risk for weight gain and eating disorders. Perception real, or is it perceived? Media and technology. Aggressive ideal beauty marketing dictates the perfect body type to which everyone should seemingly aspire. Exposure to such messaging has increased with the rise of social networking sites like Instagram that rely heavily on images. Because pictures on these forums are from people rather than marketing firms, they are perceived to be more realistic, which makes them even more dangerous. In reality, images are being altered or filtered before posting. Pressure to compete with pictures from celebrities and peers is amplified. So treatment: be informed and aware. Talk to the person about concerns and encourage to seek help from a professional. Provide sources or contact if needed. The important thing is that early detection is key, and building a healthy relationship with food and body is important.